Hey everyone, and welcome back to the channel. If you're watching this right now, chances are you felt it. That familiar dull ache, that sharp jolt, that persistent throb in your lower back. It's not just a minor inconvenience, is it? It can hijack your day, steal your sleep, and make even the simplest movements feel like an impossible task. You're not alone. In fact, it's estimated that a staggering 80% of people worldwide will experience some form of lower back pain in their lifetime. Think about that, 80%. That's almost everyone you know eventually. It's become a silent epidemic, a global crisis that sends millions to doctors and costs countless hours in lost productivity. But what if I told you that for many of these cases, the solution isn't complicated surgeries, expensive gadgets, or endless rounds of physical therapy? What if I told you that the path to a pain-free mobile back could begin with just a few minutes a day, right in your own home, with zero equipment? Today, we're going to demystify back pain and unveil the only 5 exercises you truly need to start your journey towards lasting relief. This isn't just about temporary fixes. It's about building resilience, regaining control, and transforming your quality of life. Get ready to reclaim your back once and for all. Now, before we dive into these life-changing movements, it's crucial to understand why so many of us suffer. Back pain isn't a single entity. It's a symptom with various underlying causes. Knowing the culprit can empower you to target the problem more effectively. While a doctor's diagnosis is always paramount for your specific case, generally, we see 4 main reasons for chronic back discomfort. First, and perhaps most common in our modern world, postural problems. Think about your day. Hours spent hunched over a computer, glued to your phone, or slouched on the couch. This sedentary lifestyle creates profound muscle imbalances. Certain muscles, like your hip flexors and chest muscles, become tight and shortened, pulling your body out of alignment. Conversely, crucial stabilizing muscles in your back and core weaken, losing their ability to support your spine. This constant, uneven load on your spinal structures leads to chronic pain, especially in your lower back and neck. It's a slow burn, often unnoticed until the pain becomes undeniable. Sarah, a graphic designer I know, lived like this for years, attributing her stiffness to just getting older. But it was her desk setup and prolonged sitting that were silently undermining her spine. Second, we have degenerative changes in the discs and joints. As we age, it's natural for our intervertebral discs, those amazing shock absorbers between your vertebrae, to lose some water and elasticity. They thin out, becoming less efficient. Simultaneously, the small facet joints that connect your vertebrae also experience wear and tear, leading to conditions like spinal osteoarthritis. This is a natural part of aging, but factors like excess weight, smoking, physically demanding jobs with repetitive motions, and even genetics can significantly accelerate this process. It's like the tires on a car. They'll wear out eventually, but aggressive driving will make it happen much faster. Third on our list is spondylolisthesis. This sounds complex, but it simply means one vertebra slips forward over another, most commonly in the lumbar region. This can be something you're born with, develop during growth spurts in adolescence, or be the result of trauma or cumulative wear and tear over time. When a vertebra shifts, it can put pressure on the delicate spinal nerves, leading to pain that can radiate down your legs, tingling, numbness, and even muscle weakness in more severe instances. Imagine a stack of books, and one book slowly slides out. That's the kind of imbalance we're talking about. And finally, we have spinal stenosis. This refers to the narrowing of the spinal canal itself, the crucial tunnel through which your spinal cord and nerves pass. This narrowing usually happens due to excessive bone growth, thickening of ligaments, or disc herniations, all often linked to aging and arthritis. When that space decreases, the nerve structures get compressed, causing symptoms like pain, numbness, and weakness, particularly when you're walking or standing for extended periods. A classic sign of spinal stenosis? Relief when you sit down or lean forward, as these positions can momentarily open up the spinal canal. John, a retired construction worker, found he could only walk short distances before his legs would scream. Bending over his shopping cart offered temporary comfort, a textbook example of stenosis at play. So, now that we've shed light on the main reasons people experience back pain, let's shift our focus to the solution. It's time to reveal the 5 incredibly effective exercises that can truly change everything for your back. Our first exercise, a cornerstone of spinal health, is the seated forward bend. This deceptively simple movement provides an incredibly deep stretch for the entire posterior chain of your body. We're talking about the fascia, the paravertebral muscles running alongside your spine, your hamstrings, and your glutes. Why is this so crucial? Because in people with lower back problems, these structures are almost always tight and shortened. When your hamstrings, for instance, are like taut guitar strings, they pull on your pelvis, tilting it backward and flattening your natural lumbar curve. This creates constant tension on your spine, throwing its delicate alignment out of whack and contributing to that nagging chronic pain. Beyond the physical stretch, this exercise also gently nudges your parasympathetic nervous system into action. This is your rest and digest system, responsible for calming your body and reducing overall tension. And let's be honest, stress often manifests as muscle tension in our backs. For those of us who spend a significant chunk of our lives sitting, this movement is a powerful antidote, helping to counteract the negative effects of prolonged, static posture and restoring the natural range of motion in your spine and hips. It's like resetting your body after a long day at the office. To execute the seated forward bend correctly, here's how. 1. Start. Sit on the floor with your legs extended directly in front of you. Your feet should be hip-width apart or slightly wider for comfort. 2. Knees. Crucially, keep a slight bend in your knees. Don't lock them out, especially if you feel intense tension in your hamstrings. This slight bend protects your hamstrings and allows the stretch to focus on your lower back. 3. Inhale and hinge. Take a deep breath in. As you exhale, begin to tilt your torso forward, initiating the movement from your hips, not your waist. Imagine your hips are a hinge, and your upper body is a door slowly closing. The goal is to lengthen your spine as much as possible initially, avoiding an immediate rounding of your back. 4. Reach and relax. Extend your arms forward towards your feet, but don't force yourself to touch them. The objective isn't to grab your toes. It's to feel a gentle, lengthening stretch along your hamstrings and spine. Go only as far as feels comfortable. 5. Hold and deepen. Hold the position. With each subsequent exhalation, consciously try to relax deeper into the stretch, allowing gravity to gently assist in deepening the bend. You might find you can go a millimeter or two further with each breath. Now, let's talk about common pitfalls that can diminish the benefits or even cause harm. Forcing the stretch. Never, ever force your body beyond its current flexibility limit. This is a surefire way to cause injury or aggravate existing issues. Listen to your body. It tells you when it's had enough. Bending from the lumbar. A very common mistake is rounding your lower back immediately, rather than hinging from the hips. This puts undue pressure on your lumbar discs, which is exactly what we're trying to avoid. Keep that spine long in the initial phase. Locked knees. As mentioned, completely locking your knees can put excessive strain on your hamstrings and knees, reducing the beneficial stretch for your spine. A gentle micro-bend is your friend here. I recommend holding the final position for 30 seconds to 1 minute initially. As your flexibility improves, you can gradually increase this to 2 to 3 minutes. Aim to perform this exercise 1 to 2 times a day, ideally when your muscles are a bit warmed up, perhaps after a short walk or a warm shower. If you ever feel any tingling or numbness in your legs during the stretch, ease off immediately. That's your body telling you to reduce the intensity. Next up, we have the incredibly therapeutic cat-cow exercise. This flow, rooted in yoga, is truly transformative for back pain sufferers because it directly targets spinal mobility, segment by segment. By fluidly alternating between spinal flexion, the cat, and extension, the cow, you're essentially pumping nutrients into your intervertebral discs. This is critical because these discs don't have their own direct blood supply. They rely on movement to absorb vital nutrients and shed waste. Think of it like a sponge. You have to squeeze and release it to get water in and out. For anyone dealing with stiffness in their spine, cat-cow is a revelation. It gently and progressively mobilizes all three regions of the spine: lumbar, thoracic, and cervical. It also awakens and strengthens those deep, intrinsic muscles that often become weak or dormant in people with chronic lower back pain. These are the muscles that provide subtle, segmental stability. And here's another powerful benefit. The gentle traction effect that occurs during the movement helps to release tension between the vertebrae, often relieving nerve compression, a common and immediate source of pain. I've seen countless individuals experience immediate relief from a stiff, aching back just by incorporating this simple movement. Let's break down the proper execution of cat-cow. 1. Starting position. Begin on all fours, like a tabletop. Ensure your knees are directly underneath your hips and your wrists are aligned beneath your shoulders. Your fingers should be spread wide, pressing evenly into the floor to distribute weight and protect your wrists. Your spine should start in a neutral position with a gentle, natural curve in your lower back. 2. Inhale, cow. As you inhale, drop your belly button towards the floor. Lift your chest and tailbone towards the ceiling, creating a gentle concavity or dip in your spine. Your gaze should naturally follow, gently looking upwards without straining your neck. 3. Exhale. Cat. You exhale, reverse the movement. Arch your back upwards towards the ceiling like a startled cat. Press firmly through your hands, draw your navel towards your spine, and bring your chin towards your chest. Feel your shoulder blades separating. 4. Flow. Maintain a smooth, controlled rhythm. Your breath should guide the movement, making it fluid and continuous, not jerky or rushed. Now, let's address some common errors to avoid. Abrupt movements. Don't rush. The slower and more controlled the movement, the more you'll engage the stabilizing muscles and the better you'll nourish your discs. Neck strain. Avoid hyperflexing or hyperextending your neck. Your head movement should be a natural extension of your spinal undulation, not isolated, forceful movement. Locked elbows, tensed shoulders. Keep a slight micro bend in your elbows to avoid joint strain. Relax your shoulders, drawing them away from your ears. Ignoring breath. Breathing is paramount in cat-cow. Don't neglect its coordination with the movement. Deep, conscious breathing enhances the benefits and ensures proper engagement. I recommend performing 8 to 10 repetitions of this fluid movement in a slow, controlled manner, 1 to 2 times a day. If you're a beginner, start with 5 repetitions and gradually increase. The key is quality over quantity. Pay attention to your body's sensations and respect its limits. This exercise is especially beneficial first thing in the morning to gently wake up your spine after sleep, and at the end of the day to release accumulated tension. Our third essential exercise is the spinal twist. This movement directly enhances the rotational mobility of your spine, an often overlooked aspect in many traditional back care routines. Controlled twisting offers a wealth of extraordinary benefits, starting with the mobilization of your facet joints. These are the small, bony joints between your vertebrae that, when stiff, can be a major source of pain. Gentle, controlled twists help improve the lubrication of these joints, reducing friction and promoting smoother, more fluid movement. Imagine a rusty hinge suddenly getting oiled. That's the feeling we're aiming for. The spinal twist also directly engages your oblique muscles and the smaller, deeper rotator muscles of your spine. These muscles are absolutely vital for everyday movements, like turning to look behind you while driving, reaching for something on a shelf, or simply twisting to grab a glass from the cupboard. When these muscles are weak or unbalanced, even these simple tasks can become painful and increase your risk of injury. Another remarkable benefit is the subtle decompression of the intervertebral discs during the twist, which encourages a greater flow of synovial fluid, a nutrient-rich lubricating fluid, into these structures. This further supports disc health and overall spinal resilience. Let's break down how to correctly execute the spinal twist. 1. Starting position. Begin by sitting on the floor with both legs extended straight out in front of you. 2. Bend knee. Bend your right knee and place your right foot flat on the floor, on the outside of your left knee. Your left leg remains extended on the floor. 3. Leverage. Place your left arm or elbow on the outside of your bent right knee. Use this arm as gentle leverage for your rotation. 4. Rotate and support. Rotate your trunk towards your right side. Place your right hand on the floor behind your hip for additional support and balance. 5. Elongate. Throughout the entire movement, focus on keeping your spine elongated, as if a string is gently pulling the crown of your head towards the ceiling. The rotation should initiate from the base of your spine and progressively travel upwards to your neck, where you can gently look over your right shoulder. Now, let's talk about mistakes to steer clear of. Rounding the back. This is a big one. Avoid rounding your back during the twist. Maintain that elongated spine throughout the entire movement to protect your discs and maximize the benefits. Forcing the rotation. Never force the rotation beyond your comfortable limit. The twist should be gradual and progressive. If you feel any acute pain, ease off immediately. This isn't about achieving a pretzel-like pose. It's about gentle, controlled mobility. Lifting the hip, ensure both sit bones, the bony parts of your butt, remain firmly anchored to the ground. If your hip lifts, the rotation isn't truly happening in your spine. It's compensating elsewhere. I recommend holding each side of the twist for 20 to 30 seconds, breathing deeply into the stretch. Then, slowly release and switch to the other side. Aim for 2 to 3 sets on each side daily. This exercise is particularly beneficial when practiced regularly throughout the day, especially after long periods of sitting or static positions. It's like giving your spine a refreshing little rinse throughout the day. Our fourth essential exercise is the deeply restorative child's pose. This seemingly simple posture is a powerhouse for back pain relief, particularly in the lumbar region where so many people experience chronic discomfort. What makes it so effective is its ability to promote a natural decompression of the intervertebral discs. By allowing your spine to gently round and lengthen in a supported position, you create space between the vertebrae, taking pressure off compressed nerves. But the benefits extend far beyond physical relief. Child's pose has a profoundly calming effect on your entire nervous system. The slightly curved, protected, and inward-focused position actively engages your parasympathetic nervous system, that rest and digest system we talked about earlier. This makes it an incredible tool for reducing overall stress and body tension, which, as we know, often manifest as tightness and pain in the back. For anyone suffering from sciatica or disc herniation, this posture can offer significant relief by gently opening up that space between the vertebrae and reducing direct pressure on irritated nerve roots. It's like giving your tired, aching back a gentle hug and a moment of quiet peace. Let's walk through how to correctly execute the child's pose. 1. Starting position. Begin by kneeling on the floor. Bring your big toes together so they touch, and then separate your knees approximately hip-width apart, or even a little wider if it feels more comfortable for your hips. 2. Fold forward. Gently sit back onto your heels. As you exhale, slowly lean your torso forward, allowing your chest to rest between your knees. 3. Forehead and arms. Allow your forehead to gently touch the floor. You have options for your arms. You can extend them forward in front of you with palms down, or you can relax them alongside your body with palms facing up. Choose what feels most comfortable and allows your shoulders to release tension. 4. Relax shoulders. Actively draw your shoulders away from your ears, allowing them to soften and relax towards the floor. Avoid any tension in your neck or upper back. Here are some common mistakes to avoid. Forcing hips to heels. If sitting directly on your heels causes discomfort in your knees or ankles, don't force it. Simply place a folded blanket or pillow between your glutes and heels to reduce the pressure. Comfort is key here. Tense neck. Let your head be heavy and allow it to naturally weigh down towards the floor. Resist the urge to hold your neck in an unnatural position. Holding breath, remember to maintain deep, steady, and continuous breathing. Focus on feeling your abdomen expand against your thighs with each inhalation, gently massaging your internal organs and further deepening the sense of relaxation. I recommend staying in child's pose for 1 to 3 minutes, focusing on deep, calming breaths. You can practice this exercise 2 to 3 times a day, especially during moments when you feel increased tension or stress building up in your back. A truly valuable tip is to use it as a gentle resting position between other, more active exercises, or even as a quick reset during your workday when you need a mindful break to relieve accumulated tension. And now, for our 5th and final essential exercise, the Superman. This exercise is incredibly valuable because it directly targets and strengthens your erector spinae muscles, those powerful posterior stabilizers that run along your spine. In our sedentary world, these muscles often weaken, leaving your spine vulnerable. Think of them as your body's natural support vest. When these muscles are strong and resilient, they significantly reduce the load placed on passive structures like your spinal discs and ligaments, which can become strained and painful. What makes the Superman so uniquely special is its ability to engage your entire posterior chain. That's everything from your cervical muscles in your neck, down through your mid-back, your lower back, your glutes, and your hamstrings, in a coordinated, integrated manner. This holistic activation is fundamental, as it mirrors how our bodies are designed to function naturally during dynamic everyday movements. Furthermore, this exercise builds strength in spinal extension, which is crucial for counteracting the excessive flexion we subject our spines to daily, sitting, driving, looking at our phones. It's like rebalancing the forces acting on your spine. Scientific studies consistently show that specifically strengthening these extensor muscles can significantly reduce lower back pain in chronic patients and dramatically improve resistance to muscle fatigue. It's not just about looking strong, it's about being strong where it counts. Let's detail the correct execution of the Superman. 1. Starting position. Lie face down on a comfortable mat or soft surface. Extend your arms straight out in front of you, roughly in line with your shoulders. Your legs should also be extended straight behind you. 2. Neck neutral. Keep your neck in a neutral position, looking down at the floor. Avoid craning your neck to look forward, as this can cause cervical hyperextension and strain. 3. Engage core. Before you begin the movement, lightly engage your core. Imagine gently drawing your navel towards your spine. This subtle activation helps to protect your lumbar region during the exercise. 4. Inhale and elevate. As you inhale, simultaneously and smoothly elevate your arms, chest, and legs off the floor. Keep your limbs straight, but avoid locking your elbows or knees. Imagine you're trying to stretch in opposite directions, your fingertips reaching forward, your toes reaching backward, like Superman in flight. 5. Controlled lift. The elevation doesn't need to be extreme. A lift of about 4 to 6 inches off the floor is usually sufficient to adequately activate the target musculature without straining your back. 6. Hold and lower. Hold the elevated position briefly, then slowly and controllably return to the starting position as you exhale. Now let's review some crucial mistakes to avoid. Excessive hyperextension. A common error is trying to lift too high, excessively hyperextending the lumbar spine. This can compress your articular facets and cause discomfort or pain. The movement should be a moderate, controlled extension, not an extreme arch. Using momentum. Resist the urge to use momentum or perform abrupt, jerky movements. The Superman is about controlled, deliberate muscle activation. Focus on quality of movement over the number of repetitions. Neck position. As mentioned, avoid looking forward and craning your neck. Keep your gaze directed at the floor, maintaining your neck as a natural, relaxed continuation of your spine. I recommend starting with 2 to 3 sets of 8 to 10 repetitions. For each repetition, hold the elevated position for 2 to 3 seconds before slowly returning. As your strength improves, You can gradually increase to 12 to 15 repetitions, or extend the hold time in the elevated position to 5 seconds. Perform this exercise 2 to 3 times per week, allowing at least 1 day of recovery between sessions to allow your muscles to rebuild and get stronger. So, there you have it. The 5 fundamental exercises that can truly empower you to overcome back pain and build a stronger, more resilient spine. We've talked about the seated forward bend for flexibility, cat-cow for spinal lubrication, the spinal twist for rotational mobility, child's pose for decompression and calming, and the Superman for building that essential posterior chain strength. But here's the critical truth, and it's perhaps the most important takeaway of all. These exercises, no matter how effective, are only one piece of the puzzle. To truly achieve lasting freedom from back pain, you need to cultivate a holistic approach. This means, 1. Consistency is king. Doing these exercises sporadically won't yield significant results. A few minutes every day, or every other day, is far more effective than one long session once a week. Make it a non-negotiable part of your routine, like brushing your teeth. Even 5-10 minutes can make a world of difference. 2. Listen to your body. This isn't a no pain, no gain scenario. If something feels sharp, jarring, or wrong, stop. Modify the exercise or skip it for the day. Your body is constantly sending you signals. Learn to interpret them. Pain is often a warning sign, not a challenge to push through. 3. Address your daily habits. Remember those postural problems we discussed? No amount of exercise will fully counteract hours of poor posture. Be mindful of how you sit, stand, and move throughout your day. Invest in an ergonomic chair if you spend hours at a desk. Take regular breaks to stretch and move. 4. Hydration and nutrition. Your discs love water. Staying well hydrated is crucial for disc health. A diet rich in anti-inflammatory foods can also help reduce overall body inflammation that might contribute to pain. 5. Professional guidance. While these exercises are incredibly beneficial for general back health and many common issues, they are not a substitute for professional medical advice. If your pain is severe, persistent, radiating, or accompanied by numbness or weakness, please see a doctor or a qualified physical therapist. They can accurately diagnose your specific condition and tailor a treatment plan just for you. They can identify if your pain is from something more serious than general muscle imbalances, like a severe disc herniation or neurological involvement that requires different interventions. Remember Sarah, the graphic designer? Once she understood her postural issues and started incorporating these stretches and strengthening exercises, coupled with ergonomic adjustments at her desk, her chronic stiffness and nagging pain drastically improved. She told me, "It's like I finally understood how my body worked and what it needed." And John, the retired construction worker with spinal stenosis? While his condition required careful management, even he found significant relief in the child's pose and gentle cat-cow movements, which helped to decompress his spine and improve his walking endurance, allowing him to enjoy his grandchildren again. The clear lesson here is empowerment through understanding and consistent action. Back pain can feel overwhelming, but for most people, it's a manageable problem that responds incredibly well to targeted self-care. You have the power to take control. These 5 exercises are your toolkit. Use them wisely, consistently, and always with respect for your body's signals. If you found this video helpful, please give it a thumbs up and share it with anyone you know who suffers from back pain. And make sure you're subscribed to the channel and hit that notification bell, because having constant access to correct, science-based information is what will truly help you progress on your long-term health journey. Thank you for watching, and here's to a pain-free mobile life.